For my controversial topic, I did fetal radiation exposure in nuclear medicine. A little bit of background, nuclear medicine is an imaging modality that uses radioactive isotopes in order to diagnose and treat different diseases, usually injecting those radioactive isotopes. All technologists do have set annual dose limits of radioactive materials that they can come into contact with. So that's going to be set at 5 rem. Pregnant technologists, it is much lower. It's going to be about 0.5 rem, just to mitigate any of that risk that can happen to the baby. All techs do practice ALARA, which is going to be as low as reasonably achievable. That's going to be just using the minimum amount of dose that you can in order to get the best pictures. More precautions are taken with pregnant patients or breastfeeding patients, just because those isotopes can transfer to the baby through the placenta or through breast milk. So current precautions that all techs take as of now, just wearing those dosimetry badges. Those kind of measure the amount of radiation that you come into contact with on the daily. And then using lead shields for medications, always wearing proper PPE like a lab coat and gloves, so you're not having that skin-to-skin contact. Still practicing ALARA again, and then always inquiring if your patient is pregnant or breastfeeding. So a little bit of the risks that you can have with a developing fetus. Most of the risks are going to be in that first trimester. A little bit heavier, we have fetal death, usually within the first couple weeks of conception that we're worried about. But risks do go down drastically throughout a pregnancy. So with the first trimester fetal death, we're most concerned about. The second trimester, whenever the organs are developing, we're going to be a little bit more concerned about that organ malformation. But once the organs are mostly developed and we hit that third trimester, it's more of just the cancer risk that the baby could experience later on in life with those radioactive isotopes. With breastfeeding, that's going to put the baby at about 2 to 3 times more likely to develop cancer. That is also with a high radiation dose. So most of these risks, as long as we're staying under those annual dose limits, or the dose limits for the patient, we're not too worried about an adverse effect. So do benefits outweigh risks? With nuclear medicine and any radioactive treatment, we really are using that as a last resort. Obviously, we're not going to expose someone to that if it isn't absolutely necessary. We do have those set dose limits for the patient, so just making sure we follow those and using a limited amount of radiation. There are a couple ways we can lower the exposure as well. One of those I learned being you can use half the dose with double the amount of picture time. So half the dose of the radioactive isotope and then just doubling the time under the camera for the patient. Also, most radioactive isotopes are going to be excreted through the urine, so they can collect in the bladder, which is going to be near the baby. So one of the ways you can kind of keep that moving and keep it away from the baby as much as possible is through catheterization. So if you run a saline IV and then also catheterize your patient, that will keep everything moving and mitigate risk to the fetus. Also, just not using radiopharmaceuticals that are known to transfer through the placenta to the baby. A good example is radioactive iodine. That's used a lot for thyroid scans. After 10 weeks, the baby does start developing their thyroid, so if you use that, it can transfer through the placenta to the baby's thyroid, which we would not want. So In conclusion, there has been growing public awareness about radioactive materials and using those to image. We just want to make sure we're really keeping our patients as informed as possible. As long as we stay within those dose limits, there's not too much risk to worry about. And then just having our patients, making sure they're aware of everything they can be, and just following a doctor's advice as we go on. But yeah, usually the benefits to getting these scans are pretty hefty compared to the risks. But yeah, and then I have my references. So, thank you.